Dengue. Dengue, pronounced dengue, fever is a painful, debilitating mosquito-borne disease caused by any one of 4 closely related dengue viruses. These viruses are related to the viruses that cause West Nile infection and yellow fever. An estimated 400 million dengue infections occur worldwide each year, with about 96 million resulting in illness. Most cases occur in tropical areas of the world, with the greatest risk occurring in the Indian subcontinent, Southeast Asia, southern China, Taiwan, the Pacific Islands, the Caribbean, except Cuba and the Cayman Islands, Mexico, Central and South America, except Chile, Paraguay, and Argentina. Dengue is a mosquito-borne viral disease that has rapidly spread to all regions of WHO in recent years. Dengue virus is transmitted by female mosquitoes mainly of the species Aedes aegypti and, to a lesser extent, A. albopictus. These mosquitoes are also vectors of chikungunya, yellow fever and Zika viruses. Dengue is widespread throughout the tropics, with local variations in risk influenced by climate parameters as well as social and environmental factors. Dengue causes a wide spectrum of disease. This can range from subclinical disease, people may not know they are even infected, to severe flu-like symptoms in those infected. Although less common, some people develop severe dengue, which can be any number of complications associated with severe bleeding, organ impairment and/or plasma leakage. Severe dengue has a higher risk of death when not managed appropriately. Severe dengue was first recognized in the 1950s during dengue epidemics in the Philippines and Thailand. Today, severe dengue affects most Asian and Latin American countries and has become a leading cause of hospitalization and death among children and adults in these regions. Dengue is caused by a virus of the Flaviviridae family, and there are 4 distinct, but closely related, serotypes of the virus that cause dengue: dengue1, dengue2, dengue3 and dengue4. Recovery from infection is believed to provide lifelong immunity against that serotype. However, cross-immunity to the other serotypes after recovery is only partial, and temporary. Subsequent infections, secondary infection, by other serotypes increase the risk of developing severe dengue. Dengue has distinct epidemiological patterns, associated with the 4 serotypes of the virus. These can co-circulate within a region, and indeed many countries are hyperendemic for all 4 serotypes. Dengue has an alarming impact on both human health and the global and national economies. Dengue is frequently transported from one place to another by infected travelers. When susceptible vectors are present in these new areas, there is the potential for local transmission to be established. Symptoms of dengue fever. Symptoms, which usually begin 4 to 6 days after infection and last for up to 10 days, may include sudden, high fever, severe headaches, pain behind the eyes, severe joint and muscle pain, fatigue, nausea, vomiting, skin rash, which appears 2 to 5 days after the onset of fever, mild bleeding, such a nosebleed, bleeding gums, or easy bruising. Sometimes, symptoms are mild and can be mistaken for those of the flu or another viral infection. Younger children and people who have never had the infection before tend to have milder cases than older children and adults. However, serious problems can develop. These include dengue hemorrhagic fever, a rare complication characterized by high fever, damage to lymph and blood vessels, bleeding from the nose and gums, enlargement of the liver, and failure of the circulatory system. The symptoms may progress to massive bleeding, shock, and death. This is called dengue shock syndrome, DSS. People with weakened immune systems as well as those with a second or subsequent dengue infection are believed to be at greater risk for developing dengue hemorrhagic fever. Transmission of dengue. Transmission through mosquito bite. The virus is transmitted to humans through the bites of infected female mosquitoes, primarily the Aedes aegypti mosquito. Other species within the Aedes genus can also act as vectors, but their contribution is secondary to Aedes aegypti. After feeding on a dengue-infected person, The virus replicates in the mosquito midget, before it disseminates to secondary tissues, including the salivary glands. The time it takes from ingesting the virus to actual transmission to a new host is termed the extrinsic incubation period, EIP. The EIP takes about 8 to 12 days when the ambient temperature is between 25 to 28 degrees Celsius. Variations in the extrinsic incubation period are not only influenced by ambient temperature. A number of factors such as the magnitude of daily temperature fluctuations, virus genotype, and initial viral concentration can also alter the time it takes for a mosquito to transmit virus. Once infectious, the mosquito is capable of transmitting virus for the rest of its life. Human-to-mosquito transmission. Mosquitoes can become infected from people who are viremic with dengue. This can be someone who has a symptomatic dengue infection. Someone who is yet to have a symptomatic infection, they are pre-symptomatic. But also people who show no signs of illness as well, they are asymptomatic. Human-to-mosquito transmission can occur up to 2 days before someone shows symptoms of the illness, up to 2 days after the fever has resolved. Risk of mosquito infection is positively associated with high viremia and high fever in the patient. Conversely, high levels of dengue-specific antibodies are associated with a decreased risk of mosquito infection, Wynn et al. 2013 PNAS. Most people are viremic for about 4 to 5 days, but viremia can last as long as 12 days. Maternal transmission. The primary mode of transmission of dengue between humans involves mosquito vectors. There is evidence, however, of the possibility of maternal transmission, from a pregnant mother to her baby. While vertical transmission rates appear low, with the risk of vertical transmission seemingly linked to the timing of the dengue infection during the pregnancy. When a mother does have a dengue infection when she is pregnant, babies may suffer from preterm birth, low birth weight, and fetal distress. Other transmission modes. Rare cases of transmission via blood products, organ donation and transfusions have been recorded. Similarly, transovarial transmission of the virus within mosquitoes have also been recorded. Risk factors for dengue. You have a greater risk of developing dengue fever or a more severe form of the disease if you live or travel in tropical areas. Being in tropical and subtropical areas increases your risk of exposure to the virus that causes dengue fever. Especially high-risk areas include Southeast Asia, the Western Pacific Islands, Latin America and Africa. You have had dengue fever in the past. Previous infection with the dengue fever virus increases your risk of severe symptoms if you get dengue fever again. Diagnosing dengue fever. Diagnosing dengue fever can be difficult because its signs and symptoms can be easily confused with those of other diseases, such as chikungunya, Zika virus, malaria and typhoid fever. Doctors can diagnose dengue infection with a blood test to check for the virus or antibodies to it. If you become sick after traveling to a tropical area, let your doctor know. This will allow your doctor to evaluate the possibility that your symptoms were caused by a dengue infection. Several methods can be used for diagnosis of dengue infection. Depending on the time of patient presentation, the application of different diagnostic methods may be more or less appropriate. Patient samples collected during the first week of illness should be tested by both methods mentioned below. Virus isolation methods. The virus may be isolated from the blood during the first few days of infection. Various reverse transcriptase polymerase chain reaction (RT-PCR) methods are available and are considered the gold standard. However, they require specialized equipment and training for staff to perform these tests. The virus may also be detected by testing for a virus-produced protein, called NS1. There are commercially produced rapid diagnostic tests available for this. And it takes only less than 20 minutes to determine the result, and the test does not require specialized laboratory techniques or equipment. Serological methods. Serological methods, such as enzyme-linked immunosorbent assays, ELISA, may confirm the presence of a recent or past infection, with the detection of anti-dengue antibodies. IM antibodies are detectable 1 week after infection and remain detectable for about 3 months. The presence of IM is indicative of a recent dengue infection. IgG antibody levels take longer to develop and remains in the body for years. The presence of IgG is indicative of a past infection. Treatment for dengue fever. There is no specific medicine to treat dengue infection. If you think you may have dengue fever, you should use pain relievers with acetaminophen and avoid medicines with aspirin, which could worsen bleeding. You should also rest, drink plenty of fluids, and see your doctor. If you start to feel worse in the first 24 hours after your fever goes down, you should get to a hospital immediately to be checked for complications. Complications of dengue. Severe dengue fever can cause internal bleeding and organ damage. Blood pressure can drop to dangerous levels, causing shock. In some cases, severe dengue fever can lead to death. Women who get dengue fever during pregnancy may be able to spread the virus to the baby during childbirth. Additionally, babies of women who get dengue fever during pregnancy have a higher risk of preterm birth, low birth weight or fetal distress. Can you be immune to dengue fever? Yes, you can get immunity to a version of dengue virus once you've been infected with it. Because there are at least 4 versions, strains, of the virus, DENV, this is pretty complicated. Your immune system has tools it can use to recognize infections and get better at fighting them off. As your body fights a virus, it looks through its toolbox to find out which tool, antibody, it has that can destroy that specific threat. Antibodies are specific to each harmful invader to your body, fitting to them like a key to a lock. Antibodies grab onto their specific target and your immune system destroys it. Once your body knows how to fight that specific virus, you are unlikely to get sick with it again. After getting one of the 4 strains of dengue, you shouldn't be able to get that one again. But the antibodies for that strain don't fit other versions quite perfectly. So if you get infected by a different version of dengue later on, it can actually use this imperfect fit to trick your immune system, antibody-dependent enhancement. The different strain can get caught by the antibody from the first strain you had and get pulled into your cells, but, for reasons not fully understood, it's not destroyed. It's then inside your cells without your cells knowing it's harmful. This makes it easier for the virus to infect you and cause more serious illness. How can I reduce my risk of dengue fever? The 2 main ways to protect you from dengue are through avoiding mosquito bites and vaccination. Mosquito protection. The best way to reduce your risk of dengue fever is to protect yourself from mosquito bites. Use EPA-registered insect repellents that contain 20% to 30% DEET or other ingredients known to help keep Aedes mosquitoes away. Cover exposed skin outdoors, especially at night when mosquitoes are more likely to be around. Remove standing water, buckets or barrels, bird baths, old tires that may hold rainwater, and fill low spots where water can pool. Keep mosquitoes outside of your home by repairing holes in screens and keeping windows and doors closed if possible. Use mosquito netting at night in areas where dengue is common. If you're pregnant, avoid traveling to areas where dengue is common if possible. When traveling, be sure to check with the authorities to understand if there are any outbreaks of illness in your destination before you leave. Dengue vaccine. The dengue vaccine, Denguevaxia, is recommended only if you've already had dengue before. It can reduce your risk of severe dengue hemorrhagic fever, if you get a different version of the dengue virus in the future. Getting the vaccine isn't recommended if you've never had dengue before. Because getting infected once with dengue makes you more likely to get sicker if you get another version of the virus, antibody-dependent enhancement. Getting vaccinated before having dengue for the first time can increase your risk of severe dengue. Your healthcare provider will do a blood test to check for signs of a previous dengue infection to confirm that you've had dengue before getting the vaccine. Vaccination isn't available to everyone. For instance, travelers from the US aren't yet eligible. Check with your healthcare provider to understand whether you're eligible for dengue vaccination. How long does dengue fever last? Initial symptoms of dengue last 3 to 7 days. Most people begin to feel better after this, but some have life-threatening severe dengue that requires treatment in a medical facility. Can you survive dengue fever? Most people recover from dengue fever without any lasting complications. If you have symptoms of dengue fever, you have about a 1 in 20 chance of it worsening to severe dengue. If you have severe dengue and are treated immediately at a hospital or medical facility, you have a greater than 99% chance of recovering. Complications of dengue fever in pregnancy. If you're pregnant and have dengue fever, it can cause miscarriage, low birth weight or premature birth. It's important to take steps to prevent getting dengue during pregnancy to protect yourself and your unborn child. Can you get dengue fever multiple times? Yes. Because there are at least 4 versions, strains, of the dengue virus, you can get dengue more than once. You'll usually become immune to the first strain you get sick with and can't get it again. But you can get sick with one of the other 3 strains after that. In fact, you're more likely to get severely sick if you get dengue more than once. Is dengue deadlier than malaria? No. While only a small percentage of those infected with either disease die from it, malaria is deadlier than dengue worldwide. Of an estimated 400 million people worldwide who get dengue every year, about 40,000 die from it, about 0.01%. Of an estimated 271 million people worldwide who get malaria every year, about 627,000 die from it, around 0.3%. It's important to remember that any disease can be deadlier in some parts of the world than in others. Children in Africa are disproportionately at risk of dying of malaria, whereas people living in Asia are the most affected by dengue. Vaccination against dengue. The first dengue vaccine, Denguevaxia, CTDV, developed by Sanofi Pasteur was licensed in December 2015 and has now been approved by regulatory authorities in more than 20 countries. In November 2017, the results of an additional analysis to retrospectively determine serostatus at the time of vaccination were released. The analysis showed that the subset of trial participants who were inferred to be seronegative at time of first vaccination had a higher risk of more severe dengue and hospitalizations from dengue compared to unvaccinated participants. As such, use of the CTDV vaccine is targeted for persons living in endemic areas, 9 to 45 years of age, who have had at least one episode of dengue virus infection in the past. Several additional dengue vaccine candidates are under evaluation. WHO position on the CTDV vaccine. As described in the WHO position paper on the Denguevaxia vaccine, September 2018. The live attenuated dengue vaccine CTDV has been shown in clinical trials to be efficacious and safe in persons who have had a previous dengue virus infection, seropositive individuals. For countries considering vaccination as part of their dengue control program, pre-vaccination screening is the recommended strategy. With this strategy, only persons with evidence of a past dengue infection would be vaccinated based on an antibody test, or on a documented laboratory-confirmed dengue infection in the past. Decisions about implementing a pre-vaccination screening strategy will require careful assessment at the country level, including consideration of the sensitivity and specificity of available tests and of local priorities. Dengue epidemiology, country-specific dengue hospitalization rates, and affordability of both CTDV and screening tests. Vaccination should be considered as part of an integrated dengue prevention and control strategy. There is an ongoing need to adhere to other disease preventive measures such as well-executed and sustained vector control. Individuals, whether vaccinated or not, should seek prompt medical care if dengue-like symptoms occur. To sum up, let us summarize key facts on dengue. Dengue is a viral infection transmitted to humans through the bite of infected mosquitoes. The primary vectors that transmit the disease are Aedes aegypti mosquitoes and, to a lesser extent, A. albopictus. The virus responsible for causing dengue is called dengue virus, DENV. There are 4 dengue serotypes and it is possible to be infected 4 times. Severe dengue is a leading cause of serious illness and death in some Asian and Latin American countries. It requires management by medical professionals. There is no specific treatment for dengue or severe dengue. Early detection of disease progression associated with severe dengue, and access to proper medical care lowers fatality rates of severe dengue to below 1%.
5,400. Yeah. I remember very well.
Mostly in urban and semi-urban areas. The global incidence of dengue has grown dramatically with about half of the world's population now at risk. Although an estimated 100 to 400 million infections occur each year, over 80% are generally mild and asymptomatic. Dengue prevention and control depends on effective vector control measures. Sustained community involvement can improve vector control efforts substantially. While many dengue infections produce only mild illness, dengue can cause an acute flu-like illness. Occasionally this develops into a potentially lethal complication, called severe dengue.